What supplements can be helpful for managing bipolar disorder? My name is Dr. Ruth Totten. I'm a board-certified adult psychiatrist, and I talk a lot on this app about targeting root causes of mental illness rather than solely managing symptoms with medications. And one of the questions I've gotten multiple times is what supplements can be helpful for bipolar disorder? So most of these supplements that I think can be helpful for bipolar disorder can also be helpful for most psychiatric conditions, because ultimately what these are doing they are optimizing your brain health. So there's not necessarily anything specifically unique to bipolar disorder. However, there are some supplements I would avoid if you have bipolar disorder, and we can talk about that as well. So in no particular order, number one is going to be omega-3 or fish oil. These are a crucial component of our neuronal cell membranes. They also play a role in cell-cell signaling and the functioning of our neurotransmitters. And most of us are not getting enough omega-3 in our diet. You would probably need to be eating a fatty fish like salmon, tuna, or mackerel at least 3 or 4 days a week. So supplementing with at least 1,000 to 2,000 milligrams of omega-3, ideally a combination of both EPA and DHA, is going to be helpful for most people who have mental health conditions. Second is going to be magnesium. And specifically, I do recommend magnesium glycinate for those who have psychiatric conditions, although magnesium 3A is also a good option because it does cross the blood-brain barrier. So I recommend starting with around 200 to 400 milligrams and taking it at night. It can be helpful for sleep, which is helpful for people who have bipolar disorder who may have trouble regulating their sleep. And with those doses and those formulations, there should be fewer GI side effects. With something like mag citrate or magnesium oxide, you're more likely to get those GI side effects like diarrhea. And the reason that magnesium is important is that it is a vital cofactor for many of the chemical reactions that need to happen in our neurons and other cells in order to be able to have optimal metabolism and functioning. And of course, your B vitamins are going to be very important as well for that same reason, that they act as cofactors for these chemical reactions that need to happen. So B vitamins like folate, vitamin B12, thiamine are all crucial for optimal brain health. Now, do you need to supplement these things if you don't have a deficiency? No, you should be able to get these things from your diet as long as you're eating a well-balanced diet. If, for example, you're vegan and you're not consuming any animal products, then you do need to supplement with vitamin B12 because it really only comes from animal products. And conversely, if you are on a carnivore diet or have very limited plant intake, then you probably need to supplement folate because the only real good animal source of folate is liver, and a lot of people don't like that. Now, whether or not you need a methylated vitamin B12 supplement or just a regular one, that's going to depend on whether or not you have the MTHFR gene mutation. I've done a couple of other videos on that, so check that out if you're not familiar with it. But basically, if you have this gene mutation, then it's harder for your body to metabolize folate and some other B vitamins. And so it's better to take the methylated form of these vitamins, which bypasses that chemical reaction. Next is vitamin D. So vitamin D is a crucial vitamin as well as hormone, and it has a lot of different modulating activity in the brain and is necessary for optimal brain health, proper neurotransmitter activity and communication, and neuron cell growth and maintenance. Most people in the winter, now we normally get vitamin D from sunlight. So in summer, when it's really sunny out, you can go outside for 15 minutes and get all the vitamin D that you need. In winter, however, when it's cloudy and you're covered up, you're probably going to need more like 2 hours of sunlight exposure to get enough vitamin D. And most people aren't doing that. So most people can benefit from supplementing vitamin D over the winter. Your daily requirement is 600 international units. It's higher for some other populations like the elderly and pregnant and those with diabetes. But if you're deficient, then I would take a higher dose, something like 1,000, 2,000, even 5,000 international units daily, depending on how deficient you are. And then the last one that can be really helpful is zinc. Now, we can test for zinc. It's not something that is commonly tested for, and there may be situations in which it's not covered by insurance. But supplementing with a relatively low dose of zinc is pretty low risk and not expensive. So similar to things like magnesium and the B vitamins, zinc is a crucial cofactor for a lot of our metabolic processes in the brain, and many of us are deficient. Beyond those, of course, there are some other supplements that some people may find helpful. There is evidence for use of probiotics in a number of psychiatric conditions. However, it's important to keep in mind that if you're taking the probiotic, but you're not feeding your gut with healthy prebiotics, which is things like fibrous fruits and vegetables, beans, legumes, nuts, then the dysbiosis is just going to return and the potential benefit of the probiotic will be gone. Other things that might help with sleep, like melatonin or L-theanine or valerian root, of course, for those who have trouble sleeping, might be helpful. But there are supplements that I would avoid. And what I'm thinking about are those supplements that have significant serotonergic activity, because there is the risk that these could trigger mania. So that would include things like potentially SAMe, definitely St. John's wort, and 5-HTP. We also have to worry about things that increase norepinephrine. So this could be things like ephedra or ginseng balancing, and even creatine can trigger mania in some. If you have bipolar disorder and there's been a supplement that was either really helpful or really harmful, then I'd love to hear about it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.